today, and that's bringing our total to 231 lost souls. This is always the most difficult news I receive every day. I know that it is incredibly hard on the New Mexico families and communities that are losing their loved ones, and everything we do is measured against saving as many lives as we can and making a difference in keeping as many New Mexicans safe as we can. I want to just point this out, but I'm going to go to Secretary Kunkel as soon as I say it. We are now at 115,011 total tests. That is an ineffective number for what I want to accomplish in the state, which is much broader surveillance. Given what's available in the country, it is an effective effort by this state at making sure that we're doing as much widespread testing as we can. And with that, I'm going to go to Secretary Kunkel for an update.
Thank you, Governor, and good afternoon, everyone. As the Governor said, we're over 115,000 tests. We continue to expand our testing criteria so that we can reach more and more New Mexicans. And on Monday of this week, the Department of Health announced that we would now be testing any worker that wanted to be tested. We are making that available largely through the Department of Health. Something like that requires significant resources, both in supplies and in personnel. So if you are interested, if you are an employee, you're interested in getting tested, call your local public health office. Or if you are a business seeking more of a larger event, call your local office and we will schedule that for you. I did have a slide on, there we go. As we talked about last week, we are increasing our presence in border communities, primarily in the Southwest, which Secretary Scrace will surely be talking about, and in the Northwest, where we've always been, had a presence. But these are the open parks and the border cities where we are concerned about seeing traffic from our sister states. You will see an increased presence of the Department of Health and our partners providing testings in these communities. And so the message this week is all workers, please get tested. If you can't come to us, we will come to you. Thank you.
And as we're getting ready to go to Dr. Scrace, have you focused? Thank you. I just want to point out that we're still hearing from some individuals that they can't get tested, that their employers are saying they can't. You can get tested. We're really working hard. We're going to have local elected officials also work on getting the message out. We are present in many communities, and it's basically open testing. We want to know as much about where our risks are. And if somebody's COVID-19, we want them isolated, right, for 14 days, that quarantine period, so that we don't infect anybody else. We need to know, and so we're coming into these communities. And I just really want to hit that point really hard. We want you to get tested. Information, that knowledge, is not only going to protect you and your family and your neighbors and your friends and your community, it's going to keep more New Mexicans safe, and it's going to save lives. So think about testing in that context. You can help us save a life by finding out whether or not you have the virus. So that's very helpful to us, and I just really wanted to hit that hard. Dr. Scrace, you want to go over the modeling with us?
Yes, I'm happy to, okay. Governor. Thank you. We are going to present a little bit different data today, but I wanted to start with the very first slide, which compares all of New Mexico, which is the blue dotted line, to just the Northwest, which is the red solid line, and to the rest of New Mexico that's not the Northwest, which is the green line. And we talked about this last time, and I said there was some early evidence that we might be seeing a downward trend in cases, and sure enough, we are. We've got 6 or 7 days. You can see the red line is now clearly coming down. The blue line is also coming down in relationship to that. I'm still a little nervous about the green line. I've shown you multiple slides of double peak epidemics, and we're actually seeing sort of an uptick in cases in the rest of the state, and we'll talk about that a little bit more specifically. But the ending of all three of those lines is favorable, so we're starting to see the downward trend, and that's great. On the next slide, we've got the gating criteria, and just as a reminder, these are the things that we have to do and accomplish as a state to be ready for further reopening. And I'm going to go through each one of them briefly, although I'll spend a little bit more time on spread because we got a lot of questions about that last week. The spread rate, I'll talk about in a minute. Testing, we're really dramatically increasing. I say this every week. We had 4,542 tests yesterday. We're actually in the top 10 states in the country in terms of the proportion of our population that we've tested, but we're continuing to push that upward for the reasons the governor mentioned, because we can identify people, we can quarantine them so they don't spread the disease to others. Contact tracing and isolation capacity, I told you we would have metrics this week, but we're in the process of automating the contact tracing process, computerizing the tracking of that, and it turns out the existing system only keeps one timestamp, so it's very hard to measure 2 different times. And so as that gets automated, we'll have more for you on that, but we are ramping up contact tracing, and I don't think that's something that would hold us back from moving forward. And then lastly, the statewide healthcare system capacity. We're focusing on our 7 hub hospitals. I said 8 last week, and there are really 9 of them, but just go with me on this. Presbyterian has multiple hospitals, so does some other systems. So we're focused on those hub hospitals. We did actually go above regular capacity early mid last week. We were at 120% of ICU capacity, but I've also let you know that of the 260 baseline beds, the brilliant people who are leading the delivery system effort on the medical advisory team have found ways to actually double that number, and so we still have capacity. So we're good with the statewide healthcare system.